In the last two videos, we learned why thyroid hormones can give insight into our health and also the basics around thyroid hormones and how they communicate between the hypothalamus, pituitary, and the thyroid glands. In this video, we're going to be talking about the thyroid stimulating hormone. It's most commonly referred to as the TSH. This is the most sensitive test to determine how your thyroid gland is doing. Is it pumping out the right amount or too much or too little of the thyroid hormone compared to what your body needs? The TSH is a hormone secreted by the pituitary gland to stimulate the thyroid to produce more hormone. So this is the test that most clinicians and patients are familiar with. It's a stimulating hormone. It's not the actual thyroid hormone used by the cells. This hormone tells the gland to pump out more or less of the thyroid hormones. It's not uncommon for clinicians to rely solely on just this test to do a diagnosis and start treatment of thyroid disorders. Typical range on TSH would be 0.4 to 5 milli international units per liter. Based on my research, I find optimal ranges are 0.8 to 1.8. So first I want to talk about hypothyroidism. So think of that, the TSH goes high. That means the pituitary gland is sensing there's not enough circulating thyroid hormone, the T3 and T4 in the bloodstream. And by elevating the TSH, it tells the thyroid to produce and release more thyroid hormone into the bloodstream. The high TSH indicates an underactive thyroid gland. The most common reason for this underactive thyroid gland is the Hashimoto's thyroiditis. It's named after Japanese doctor, Dr. Hashimoto, in the early 1900s. This is an autoimmune disease where the nature of autoimmune disease is that your immune system is attacking itself. In this case, it's attacking the thyroid and preventing it from pumping out enough thyroid hormone. There's other causes like some drugs, lupus, it could be lack of iodine that your thyroid needs to make thyroid hormone, surgery, and other causes. But there's a bunch of symptoms that go along with this hypothyroid. It could be something as minor as constipation, acne, dry skin, and hair, even that eye twitch that some people get. Moderate signs and symptoms can be headache, brain fog, poor memory, depression, insulin resistance, weight gain. It can disrupt your other hormones like estrogen, testosterone, progesterone. It can even be as severe as congestive heart failure, diabetes, heart attack, and even psychosis. The traditional medicine approach to low functioning thyroid is just replace the thyroid hormone with a pill once a day. And this provides what the cells need during that time. But the problem with this approach is it does not take into account what the root cause of the underactive thyroid even is. Could be good as a short-term solution while you're solving your problem, may be good as a long-term solution depending on what the problem is. In my case, I don't have a thyroid, so I will need it long-term. But on a case-by-case basis, I think is the best way to approach it. The opposite of hypothyroid is hyperthyroid. This is expressed when the TSH is low. A low TSH means the pituitary gland is sensing that there is too much circulating thyroid hormone, the T3 and the T4 circulating in the bloodstream. By lowering the TSH, it stops the signaling of the thyroid to produce and release more thyroid hormone into the bloodstream. So that indicates an overly active thyroid gland. Coincidentally, the most common reason for an overly active thyroid gland is also an autoimmune disease known as Graves' disease. It's, again, the immune system attacking itself, and in this case, the thyroid's responding by pumping out a whole bunch more thyroid hormone. There's other causes of this as well, like non-cancerous tumors on the thyroid, tumors of the ovaries or testes even. You could have excessive iodine causing this problem. And in less than 1% of the cases, it could even be an indication of a pituitary gland dysfunction. Signs and symptoms of hyperthyroidism could be warm or moist skin, sensitivity to heat, also brittle hair and nails. Moderate signs may be like hyperactivity, increased appetite, a weight loss, an enlarged thyroid, irregular menses, muscle weakness. And severe signs would come more like bone fractures and irregular heart rhythms. I did include a handout in the link below. You can click on that and you can get a full handout of more extensive list of hyper and hypothyroid symptoms. Traditional medicine says to treat this overly active thyroid when the TSH is too low and the thyroid is pumping out too much hormone by, hey, just give it, an anti-thyroid medication or radioactive iodine therapy or even surgery to reduce the thyroid hormone production. The problem with that approach is Again, it doesn't address the root cause of the hyperthyroidism. Unfortunately, the treatments used for the overly active thyroid gland will damage the thyroid and almost always will eventually result in a low functioning thyroid that requires someone to then take thyroid hormone therapy after their thyroid is too damaged to produce enough thyroid hormone. So they ultimately end up being hypothyroid once it's all done. So think of that Graves' disease patient who has an overly active thyroid, and then after receiving treatment, they end up on thyroid hormone replacement for life because their thyroid no longer functions once the treatment has been administered. It's worth noting that in most cases, additional testing should be done before officially diagnosing and starting treatment for thyroid disorders. But are you noticing a pattern here? The two main causes of thyroid disease that result in hyper and hypothyroid are both autoimmune diseases where the immune system attacks its own body. The immune system misfires and goes after its own cells. You may be wondering if someone can have Graves' disease and Hashimoto's thyroiditis at the same time, and the answer is it's rare, but it absolutely can happen. It's really a matter of how your thyroid is responding to being attacked by the immune system. As a matter of fact, if you have one autoimmune disease, you're often going to end up with a collection of autoimmune diseases like I did. Women have autoimmune diseases 4 times more often than men do, but men are still very susceptible. The thyroid is often the first sign of autoimmune disease. Any person who has any kind of autoimmune disease should get a full thyroid panel checked because autoimmune diseases run together. Next week, we will be talking about the thyroid hormone T4. Let me know what you're learning so far and any questions you may have by responding to the comments section below or responding directly to the email.